Good morning, everybody, and welcome to Health Talk by Dr. Niru Prasad. I'm your host with my background in pediatrics and emergency medicine. Besides being a clinician, I'm also involved doing lots of and community and voluntary work, including one of them being doing producing my own shows Health Talk on Bloomfield Cable TV. During my show, I'd invite guest speakers from different fields of medicine, surgery, and more, and we talk about the recent advances. Currently, COVID-19, coronavirus pandemic has become a burning issue. Millions and millions of people are affected all over the world, approximately 4 million people, and their mortality rate in other countries as well, United States, is getting high every day. There are some states where the curve has flattened, however, still more and more cases are being reported. Today, this is the part 3 of my COVID 19 talk, and today I'm going to talk about the new updated guidelines from American Academy of Pediatrics and the CDC regarding COVID 19 pandemic in children. More and more children suffering from COVID 19 are being reported as time progresses from different states of United States, urban and rural area. The symptoms of COVID 19 differ from adults, and their symptoms initially are milder. Severe illnesses affecting the children include fever, cough, shortness of breath, and some kind of body rash on the body. Some kind of body rash. Among the 2572 COVID cases reported in children, the mean age were 11 years. However, the range is from 0 to 17 years. The mortality of children affected was due to the fact that some of these children had underlying respiratory diseases like chronic asthma, cystic fibrosis, malignancy, and malnutrition. So, how do we protect our children from this deadly virus? First of all, I would like all of you to know that there is currently no vaccine available. The virus spreads mostly from person to person contact, so a lot of emphasis should be put for social distancing about 6 feet. Very important. Third, third of all, wear mask while getting close to an infected person, since the virus spreads during cough or while scratching your eyes. The virus gets to the eye. Since this is a very thready RNA virus, initially though this is inactive, but once it is absorbed by the mucosa of eyes, nose, throat, throat, it clings, the spikes surrounding the virus, lipid soluble, it clings to the mucosa and starts damaging the mucosa of the respiratory tract system. Once it goes to the lungs, then the person develops shortness of breath and symptoms of pneumonia, needing ventilators. So the whole anatomy of this virus plus how it is originated in December 1999 has been mentioned in my previous videos. This video emphasizes the COVID-19 in children. Washing hands thoroughly with soap and water for minimum of 20 seconds kills the kills the virus. Clean and disinfecting the frequently touched kitchen surfaces, kitchen surfaces, your surfaces with the most common EPA registered household disinfectant is very important, especially the kitchen counters and the cooking area. How do you test for the COVID-19? Usually, a viral test from nasal or pharyngeal mucosa to detect the present infection, an antibody test to detect if the child had previous infection. Considering the fact of this virus spreading so fast, anxiety and fear among our school and college students are growing more and more. Much has been mentioned about this in my previous article. Parents and the caretakers they play a very important role in nurturing their kids during this hard time. With summer around the corner, schools closed during the springtime, the children are pressured with the online summer programs. However, this whole thing keeps them isolated. Hence, there is a feeling of anxiety, sadness, and uncertainty leading to the depression in these kids. Our telehealth services and online therapy they help in easing the tension of our children. There are several websites that has been mentioned in my talk about getting more information regarding the telehealth system. The CDC and the World Health Organization, as well as the American Academy of Pediatrics, has mentioned those sites which anybody can easily look through. There are still many uncertainty that will affect a child, such as such as the loss of parents due to the disease, loss of job, financial burden, and all those. One thing we know for sure that this 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 pandemic virus has changed the whole lifestyle of all the individuals around the world, and we just hope and pray to God that this fades away soon. Recently, it has been the COVID-19 among children have been linked to a serious rare illness like a Kawasaki disease in children. Our previous research and CDC reports had indicated that COVID-19 is less among children even though they got the infection from others around them. The symptoms of respiratory illness mostly go unnoticed. The New York City last month reported 93 cases of severe respiratory illness in the children, and 15 to 20% of them were positive for COVID 19. A rare form of mysterious illness. Initially, it was reported from London, United Kingdom, later on from one case at California, and now New York, where the kids with the suspected COVID-19 developed symptoms suggestive of Kawasaki disease, which is a self-limited disease involving many systems of the body, and most important is involvement of the coronary arteries in the heart, leading to chest pain, shortness of breath, like a symptom suggestive of heart attack in children. which is due to the hardening of the coronary artery. Furthermore, these patients with the Kawasaki disease also develop a bleeding disorders and due to the clotting mechanism. Here are a few facts to remember for the parents, caretakers, and pediatricians about the Kawasaki disease. The like mentioned before, it is a disease that causes inflammation in the wall of the arteries, resulting in less blood flow to the heart. The common manifestations in children include cold symptoms, high fever lasting for more than 5 days, abdominal pain with diarrhea, swollen glands in the neck, dry cracked lip, red eyes, and blotchy rash over the body. There is a diagrammatic illustration of a child with this symptom that I'm projecting. However, this is just seeing starting from the eyes, involvement of the hands, which becomes red, the rash over the lower extremities, conjunctivitis, and more symptoms. Like I said, the common manifestations included the abdominal pain, diarrhea, and a blotchy rash over the body. According to United Kingdom National Health Services, as reported 2 weeks ago to CDC and American Academy of Pediatrics, this mysterious inflammatory disease affects children less than 5 years old. Thankfully, this disease is very rare, self-limited. However, since it is linked to COVID-19, creates much more problems in those children. The dis- this is the this is a leading cause of acquired heart disease in children at United States. According to National Health Services, 25% untreated cases they develop later on serious heart complications in their life. The etiology of this disease is unknown. However, experts admit to the fact that some inherited genetic link from parents as well. Those children from Northeast Asia, Japan, Korea are more susceptible to this disease. So, what is the link to COVID 19? A report released in April by CDC claims that COVID 19 in children still remains small. However, in infant and babies, the symptoms can be more progressive and severe, needing hospital admission. How is the diagnosis made? There might be something about the link of SARS CoV-2 virus or its specific receptors which interfaces with the human cells and triggers the symptoms of Kawasaki disease. There is no blood test, no swab test for the diagnosis as of now. However, the research has been going on in the laboratories all over the world to find the exact diagnosis. Number one, to diagnose if there is any vaccination available for this mysterious disease. But as of now, the treatment for the Kawasaki disease or this mysterious illness in children includes a general supportive care such as IV fluids to maintain the hydration, prevent the children from getting getting weak, taking care of the rashes all over their face and the body, and maintaining their proper nutrition, which is very important. A heavy dose of aspirin has been tried to prevent the blood clot from happening. Intravenous immunoglobulin is a cocktail of antibodies collected from the donors and is being used for this purpose as well for other severe inflammatory diseases. The American Academy of Pediatrics agree with World Health Organization to recommend ibuprofen during the pandemic for these children. The American Academy of Pediatrics also recommends Tylenol to ease the symptoms. As mentioned previously, antibiotics have no role. Vaccines all over the world are being researched for. However, currently there is no vaccine. The American Academy of Pediatrics also recommends parents to talk with their assigned pediatrician about the symptoms when the children should be checked up and more. So in summary, the COVID-19 pandemic has become a nightmare for people all over the world, and hopefully we pray to God that we are soon able to get rid of this virus and we have enough vaccination for these children and the proper treatment. Thank you.